Hello and welcome to Steve's Vintage Model Builds. Thanks for stopping by. Today it's going to be something completely different. Haha. Not going to be about model kitten, not going to be about politics, not going to be about things going on in the Middle East. I'm going to talk today about the medical procedure that I had done. And so now, I have to say from the outset, I mean, of course I have some knowledge, but when you want to look at heart health, there's plenty of experts out there, and information is really easy to access. Just make sure you get it from a reputable source. It's not complicated. So, excuse me. Anyways, so I'm just going to describe my experience, and hope it might be helpful for people who may be having to have the same kind of thing done. Fortunately, it's very common, and it's a well-established procedure, and it's very low risk. So, but for those who might be a little bit squeamish about these things, I'll put in the description, times you might want to skip. But there's not going to be anything too graphic. It's just going to be, yeah. So, anyways, my friends know what happened to me in 2015 with the heart attack that I had. It was called STEMI, STEMI. And what it stands for doesn't really matter, but what matters is it's the worst kind of heart attack you can have. And they also know I was flatlined for 12 minutes, and so I'm very lucky to be here, almost fully, completely, totally recovered. So at the time of that original heart attack, I had a procedure called angioplasty, where they put a little teeny tiny little wire up inside and down into your heart and into the blood vessel, and they inflate a balloon that clears the blockage. It's blocked with cholesterol usually, or plaque they call it. Yeah. So and that prevents blood from getting through, which causes the heart attack. So, anyways, yeah. So, and then they put what's called a stent in, and I'll describe that further. But it's like a little mesh tube that kind of reinforces the walls of the blood vessel. So, that procedure saved my life then. And I was very fortunate in that there was although I was flatlined for 12 minutes, I was in the emergency room, in the cardiac emergency, and I got the full treatment there during that 12 minutes. Let me tell you, I got the epinephrine in the heart, I got the adrenaline in the heart, I got the thumper, the big piston that pounds down on you. And so, anyways. Yeah, so I got the full treatment there, but fortunately there was no damage to the heart muscle itself, and the doctors told me afterwards that that otherwise I was completely healthy, but it was the smoking. I'd been a heavy smoker for 40 years, almost 40 years to the day actually, and so it was kind of inevitable. So in any case, I'm not going to say anything about that. I've since quit smoking, and I'm very happy that I did that. And I don't really miss it. I don't miss the cravings. I don't miss the expense. I don't miss lots of things about it. So, anyways. So I know I have friends out there who are smokers, and it's personal choice like anything else. So, but it's certainly a good thing to give up if you can. Yeah, love you. Okay, so where was I? Oh yeah, okay, yeah. Yeah, so I was very fortunate, except for, and again, my friends know this, and viewers know this, and anybody who watches my videos wouldn't be surprised to know. There are varying degrees of lingering cognitive effects. My GP described it to me as the entire experience was it was like a hard crash of a computer system, of a very complex computer system, which is the brain, and then just as hard a reboot. So yeah, some lingering effects there. The OCD ebbs and flows, sometimes a little difficult to deal with. Same with the ADHD. But for the most part, I manage that. And, there's a few other things, ums and ahs and all that kind of stuff. And, just, I have problems with juxtapositioning things. I mean, we've all done it. We put the thing on backwards or on the wrong side or whatever. But I really struggle with that sometimes. Not all the time. But anyway, so I'm very fortunate to have survived, very fortunate to be here, and very blessed to be otherwise very healthy. However, again, viewers will know, while we had a wonderful time while we were in Japan, the travel experience to and from Japan was very stressful in a number of ways, not only psychologically but also physically. And so, I should back up a little bit. So after the first heart attack, when they had the camera in there and they're looking inside there, they also identified another blockage, but it wasn't nearly as bad. And so they decided that I've been through enough. They were just going to do the one, and then they booked me in to have the second one done. I guess it was maybe about 6 months later, 8 months later, something like that. And so they cleared that blockage, and I was awake the whole time for that, and watched the whole thing on the monitor. And I'll describe it more in a minute. But this was in a different place, and it was just, it was a half-day procedure, just as this one was. You go in fairly early in the morning. They get you set up. They get you prepped. Doctor comes and talks to you. The procedure itself only takes about 45 minutes, 50 minutes, depending on what they need to do. Could be as quick as half an hour if they get the camera in there and they see everything's fine, and that's it. That's all there is to it. So. And then there's a couple hours, about 3 hours of recovery, where for the first hour you pretty much have to keep your arm at rest, and then for another hour you're allowed to get up and walk around a little bit and stuff like that, and then yeah. So, anyways, so so it was done at St. Paul's Hospital in Vancouver. Which is has one of the best. They're affiliated with UBC, or UBC is affiliated with them, and has one of the best cardiac programs in the country. Not just cardiac catheterization, which is what they call my procedure, the procedure I had, but all sorts of other cardiac stuff. So, anyways, premier institution. I'm very lucky about it. There's a lot of things to criticize about our health care system. But this was just, I've always had a good experience at St. Paul's. Lionsgate Hospital in North Vancouver, not so much, but I'm not going to get into that. So, anyway, St. Paul's has always been fabulous. Okay, so we're going to get rid of my face. Yeah, it's been, it's been fine, but I'm feeling lazy, so I didn't take a shave. Sorry, guys. But, that's the way it is. So anyway, so now I'm going to get on with it, and I'm going to describe the procedure, and we'll go from there. So I'm going to turn the camera down. button up my sleeve. Presto. Remember that? Bullwinkle? Anyways, so, okay, I'm going to lower the camera too and bring it down. I'll do this. See, that's probably a better view. Yeah. Okay, there we go. There. Okay, so this puncture wound here, this is where they gave me a local anesthetic. They put in an IV. Oops. You see that? Okay. Sorry about that. So they put in an IV, and this bit of bruising is normal. They put in an IV here, an IV port, it's called, and they give you an IV drip of saline solution just because it's good for you, and helps prepare your body for the, although it's minimal, it is stress to the body. Excuse me. And then they also give, at the time of the procedure, they put in a painkiller and what they call a calming medication in. So I don't really need the calming medication, but you know, the second time I had it when I was awake and everything, and they asked me all the questions, and the pretty nurse asked me if I wanted a calming medication, and I was kind of like, and she looked me straight in the eye, and she said, "You want a calming medication?" Oh, okay, yeah, I want a calming medication. So, anyways, so yeah, they're all great there. It's a great group of people, great team. Thanks to Jay, thanks to Dr. Akem, and also thanks to A Mong, Amyong. I'm sorry if I mispronounced that. And head of the program, the indubitable Dr. Boone. Thank you all. Okay, so yeah, okay, so here, and then here they put in just a local anesthetic. I think it's cocaine, but I'm not sure. It's not Novocaine, I know that. Anyway, so they put in the local here, and it actually took, I'm pretty good with pain and stuff, but they always tell you, you know, you really shouldn't feel anything, so if you're feeling anything, tell us. So, and I was feeling something. It was a little achy still, so they gave me a second one. So there's one there and one there. And then here, this is just a bruise here. I think, yeah, that's just a bruise here. Okay, and here, this dot, this is the entry point. And as I said, it's called cardiac catheterization, and they start out with what's called an angiogram. And what the angiogram is it's a tiny micro camera on the end of a filament, and they run this up this is your radial artery, the one where they take your pulse all the time. They can also go through the groin if they have any problems here, if you have weak veins or something like that, but I'm fortunate, again, my veins are very strong. My blood vessels, all of them are very strong. They never have any trouble getting blood out of me, that's for sure. So yeah, so then it goes in there, and they wind it all the way up, all the way up, all the way up, all across your shoulder and down into your heart. And then they can see what's going on. And the doctor directs it into the area that the test I had previously was the issue, and took a look and saw that yes, I had done some damage to my existing stent, the second one. First one's fine. And as I said, with the Japan trip, the travel was very stressful, and after we got back, I started to have symptoms, angina, which I had hardly ever had, and it didn't subside when we got home. So anyway, we did the test here at the hospital here, which was good. I didn't have to go to the mainland for that. And it identified a potential area, and so so they scheduled me and they got me in, and here we are now. Okay, so so they send that little filament with the camera, and then they see what's going on. And so yes, they found that right where the existing stent met the blood vessel, there was some damage there. So what they did was they put in another microfilament that has the stent on the end of it and the balloon, and then they ran that up and down and into it, and they inflated the balloon and cleared the problem, and inflated the blood vessel so the stent could be placed, and it was like a straw inside of a straw. So after describing that, I will show you the diagram. Okay, so this is a pictograph of my heart. What this is this isn't just a diagram with stuff on it. This was generated by the computer, and it's in effect, how do you say it? It's kind of a simplified blow up of what's actually there. So anyway, so this is my heart. It's not a generic heart. That's what I'm trying to say. There we go. Okay, so this the hash marked areas here are where the stents are. The stents. There's a legend down the side here. You probably can't see it, and I'm not sure if you can see it. I'll try, but on the original stent here, you can still see there's teeny amount of blockage there. Those gray lines right on the edge. And you can also see the same thing here. And more importantly, up here, I'll talk about that in a minute. So this was the existing stent. No problem with this one. This one is fine. And I should say, this is the PLAD, and that's the proximal lateral lateral aortic descending artery. There it is. So as you can see, it's the big one, the biggest one. Okay, so so here was the original stent. This circled area here, and you can also see where there's a tiny bit of blockage there, but that's nothing to worry about. And this is where they put the new stent. They placed the new stent and kind of slicked it in so it overlaps here. Here, since the beginning, we've been aware of this blockage. So this wasn't a blockage. This didn't have a blockage that needed to be cleared. It's the area where the previous stent met the actual blood vessel that needed to be reinforced, and so that's what they did. And here, and this is good news, is you can see these little gray lines just barely on the edge there. I hope. Can you see those? I've drawn two blue lines in the middle. Those two blue lines in the middle are what that blockage used to be. And now they're much reduced. So they've gone from, it's gone from something like 45% down to, no, actually I think at one point it was 65%, and then it went down to 45%. They don't do anything about it until it gets to be like 80%. Go figure. But anyways, so anyways, so that's been reduced by more than half since the last time I had a picture like this. So that's great. And as far as the stent itself is concerned, it's like this stuff. You know, this stuff that, you use it to put your cords together. So it's like a mesh, synthetic fiber mesh. I believe they're gray, but I'm not sure. Um, and that's exactly what they do. Is they go into the blood vessel, the area that's been blocked and damaged by the blockage. Because when they're blocked, that part of the blood vessel doesn't get blood. So they essentially that's what causes the heart attack. I mean, that part of the blood vessel essentially dies, and it's fully blocked, and that's the end of things, usually. So anyway, so yeah, so that's what it is, and so it's we're fortunate to live in a country where it's a fairly common procedure, and also fortunate to have a hospital that's equipped to do it. Unfortunately, the only one we have here on the island is down in Victoria, and it was going to be a long wait time there because they're the only cardiac hospital on the entire island, which is ridiculous. But I'm not going to get into that. So I have to say, overall, as far as my cardiac situation, my heart is concerned, I've been treated very well by the healthcare system, for the most part. Anyways, so yeah, so that's it. Again, the heart's one of the most important organs in our bodies. We can get along with quite minimal brain function, and even fairly reduced lung function. But we cannot do without the heart, which circulates all the blood, which takes the oxygen from the lungs to the brain and the rest of the body, etc., etc., etc. So, again, I'm not an expert, but I'm just going to throw this out there, and it's nothing that isn't already out there. Here, look at my face again. There we go. Yeah. If you're over 50 years old and you're a smoker, you should be getting at least annual ECGs, electrocardiograms. They're not expensive. They're usually easily done at your local diagnostic center, depending where you happen to be. I know different healthcare systems are different, but it's a pretty basic thing that most healthcare plans should cover. And again, depending on what that shows, you might also need to undergo an annual stress test. And particularly if you're over 55 and you're a smoker, you definitely should undergo a stress test annually, as well as the regular EKGs or ECGs. So that's just part of taking responsibility for your own health. Other things to watch out for, and this list certainly isn't exclusive, and again, I'm no expert. I'm not in a position to really give advice, but I was fooled. You hear about the left side. You're always hearing about pain in the left side. Well, my pain was in the right side, because that's where this artery is. And it was like a dull pain, like almost like bursitis or something like that. And as a matter of fact, I tried getting shots for it a couple times. It didn't do anything about it. It was only afterwards that we realized, when I told the doctor, because they always ask you, were you feeling anything? And I said, oh, well, there was just this. And he said, oh, yeah, that's... So, anyways, and also, it can be a heaviness in your chest. Almost, like you're a little out of breath, but you're not. Or if you may indeed become a little out of breath. Or it can be a fairly sharp pain. So you got to listen to your body about things like that. And you got to take responsibility for your health. It's not only the right thing to do because that's what responsible adults do. But also for your family and loved ones and friends and so forth. You gotta take care of yourself. Um, and of course, exercise as much as you can. And it doesn't have to be super strenuous exercise. And always talk to your doctor before you start an exercise program. But walking, especially if you're an older person, is a great way to go about it. So at least get a start on it. So yeah, so that's the words of wisdom that I can give you. Pay attention to those little things. The same goes for other areas of the body. It's not normal for there to be blood in your pee or your poo, and so if that's happening, then you need to have that looked at. Um, yeah, and yeah, and also get your blood work done annually for your cholesterol and all that kind of stuff. Um, and so, anyways, yeah, it's better to take medication than to have a heart attack and be bedridden for the rest of your life, or be, um, not able to be very active. Again, I was very fortunate. Um, at the time, they called me a 3%er. Only 3% of the people who had happened to them what happened to me actually survived the event. And I was later informed that I am now a 1%er, which is that only 1% of the people that went through what I went through are still alive after 5 years. And so here I am after 10 years, still going strong, and all my numbers are good. We got this taken care of, and there should be no further problems. So I'm very thankful for that. Okay, so pay attention to yourself, pay attention to your body, care about yourself. You're worth it, and so are your loved ones. And that's all I'm gonna. That's all I'm gonna say about that. So, anyways, I hope my describing the procedures helped alleviate anybody's nervousness or anything. If they're needing to undergo that kind of procedure, or if they think they're having some problems and they might have to have that procedure. All procedures have risks. This is a very low risk, and trust me, it's a heck of a lot better than having to go through bypass, where they have to split you right down here, open you up, and get in there to do it. So it's you don't want that. And some people might say, oh yeah, okay, so I have the big one and I dropped dead. Yeah, well, okay. Uh, your loved ones might be upset about that or not. But more importantly, a lot of times you don't just drop dead, and you end up being disabled for the rest of your life, and very limited in your activity, and diet, and so on and so forth. So that's something to think about too. So, all right. So yeah. So that's it for today. I hope people have found it helpful, or interesting. Um, and information is key, and that helps dispel fears and nervousness and so on and so forth. And but you need to be your own advocate. You need to question your doctors and your healthcare providers if there's anything you don't understand or it doesn't make sense. Um, it's important to ask those questions, and any healthcare provider worth their salt will be more than happy to answer any questions you might have. And they're supposed to be trained to encourage it. So that's all I'm going to say. Yeah. So so that's all there is to it, and it's not a big deal. So thanks so much, and we'll see you next time. Bye now.